Hello, and welcome to our recorded briefing, Bold on Early Educator Compensation, Lessons from Yesterday's and Today's Bold Leaders. My name is Annie Dade, and I'm honored to be here today with my colleagues Dr. Marcy Whitebook and Sylvia Munoz. Before we get into today's presentation, I'll tell you a bit about our center, the Center for the Study of Childcare Employment, or CSCCE at UC Berkeley. Our purpose is to provide research and analysis on the preparation, working conditions, and compensation of the early care and education, or ECE, workforce. We develop policy solutions and create spaces for teaching, learning, and educator activism. Our vision is an effective, public, early care and education system that secures racial, gender, and economic justice for the women whose labor is the linchpin of stable, quality services. Today, we'll be sharing reflections on the work in states and nationally to advance early educator compensation. For the past 2 years, CSCCE has hosted the Bold on Early Educator Compensation Learning Community, a gathering of leaders from 7 states who are pursuing bold, innovative compensation strategies. In 2023, we conducted deep dive case studies from 2 of these states, New Mexico and North Carolina, to understand the policies and strategies that they have employed to make advances towards appropriate compensation for early childhood educators. We'll share more about those later. But CSCCE's work on compensation for the early care and education workforce actually owes its roots to work even before the official genesis of the center, back to the activism of teachers and providers in childcare programs in the late 1970s, 80s, and 90s, which included our founder and Director Emerita, Dr. Marcy Whitebook. Today, Marcy will offer a historical perspective to ground our conversation on ECE compensation, research, and activism. Over to you, Marcy.
Thanks, Annie, and hello, everyone. I was among many teachers and providers in the 1970s, 80s who were activists in the anti-war, civil rights, and feminist movements, as well as passionate about working with young children. My first job in a co-op for infants and toddlers was set up by their parents who couldn't find any childcare. I loved the work, but not the conditions or pay. As I started talking to other teachers and providers, I discovered they shared the same frustrations that I did. Not just low pay, but lack of respect, no breaks or paid time off when we were sick, or health coverage. We didn't realize how bad the working conditions would be when we started, or why. We just knew we wanted to fix them, and we wanted to do something to make care more affordable and available to families. No one ever said, this is why the system, what the system is about, or this is why what you can do to change it. We found ourselves admonished, your role is to be there for the children, not to be concerned about yourselves. But we understood that we can't take care of children and families as we want to and they need if we can't take care of ourselves. I had the good fortune to have a wonderful advisor, Millie Almy, who told me she faced the same problems and frustrations in the 1930s during the Depression and World War II when she worked in early childhood. She spurred me on to study why we had the kind of system we have and told me to try to figure out how to change it. After a year of study, I put up a poster around Berkeley and Oakland, where I live, for a meeting about child care history, which I think you will see on the screen. And to my delight and surprise, 15 people, all teachers and providers, showed up, and we began to learn together and to meet regularly because we realized that nobody was going to fix the system for us. The fix required our voices, commitment, and energy. We were very intentional about learning and building effective skills for organizing on the job, boosting our confidence to speak out and as leaders, not just in our classrooms, and to learn about policy so we could sit as full players at tables where decisions were being made about the system. We were also playful and creative, and we began by using the tools of our work, like songs and stories, and even Play-Doh in our outreach to others in the workforce and policymakers. We hoped to launch a national grassroots movement, and we did in 1992, called the Worthy Wage Campaign, but we met for 15 years before it started. We didn't have social media. Meetings, letters, newsletters, and phone calls, which were very expensive then, were our communication tools. But we built very close relationships and friendships, and we learned how to grapple with differences and conflicts among us, as well as shared problems. Most critically, we supported one another. You can explore this history on the ECHO's website at CSCCE, which we created to provide an accessible way for people to learn about, be guided by, and take inspiration from those who have struggled to make changes since the 19th century in how children are cared for and educated. Our stories from the end of the 20th century can also be found on ECHOs in the Compensation Movement Archive. And we also have our new report, Working for Worthy Wages, A Lived History of the Child Care Compensation Movement, 1970 to 2002. And you can, as you look at these things, you can explore about our strategies and how or whether you think they would be useful to your efforts in the 21st century. Today, it is important as ever for educators and caregivers to work together to change the system and support each other. Our country has yet to embrace and adequately fund ECE as a right and a public responsibility, and certainly has failed to truly value and recognize the contribution and expertise of our workforce. I think the workforce has it harder today than we did. We had more time to meet with each other and more freedom to make decisions about who to teach, how to teach and care. We weren't being rated, and we weren't being told by people, some who had never worked with children, about what was the best way to do it. And we didn't have to report all of our tasks. And of course, we weren't dealing with changes like something from COVID. Today, there's a better understanding now than there was a generation ago about why teachers and providers need better compensation and how inequities respect to race, ages of children served, and caregiving versus teaching roles endure and require change. And there is somewhat more of an embrace of workforce advocacy and leadership. Because public financing for ECE has never been sufficient and usually is decreased or removed when policymakers think the crisis that they used it for is over. Think the American Rescue Plan comes to mind. It is discouraging. This has happened repeatedly over the decades, but you will hear today how some states are trying to overcome these barriers. Movements for justice and equity are not just one-shot deals. When they work or they don't work, it can take decades and centuries to change things, often with steps backwards. When I hear about what people are doing in some states, as Annie and Sylvia will share in a minute, it heartens me to see that building on our 21st century work and efforts, whether they ever knew about what we did or not. So on behalf of myself and my Worthy Wager friends and our ancestors, we thank you for your interest and commitment, which reminds us that our lives have been well spent.
Thank you, Marcy. It's such an honor to be able to work with you on this and to see how the legacy continues. So, as Marcy spoke about, low pay has been an issue that early educators have been calling attention to for years. And to understand where we are today, we need to listen to the lessons of the past and honor the stories of teachers and activists who have shaped the movement for a more just ECE system. Unfortunately, our ECE systems continue to fail early educators. As of 2020, 98% of other occupations were paid more than childcare teachers. And in our 2020 Early Childhood Workforce Index, most states ranked as stalled on meaningfully addressing compensation. All the while, families face unsustainably high prices and an inadequate supply of childcare in a policy-borne crisis referred to as a broken market. We also know that prior to the pandemic, early educators faced poverty rates higher than K-12 teachers, and in particular, Black educators and educators working with infants and toddlers faced even further wage gaps. This shows how systemic racism, devaluing the work done by women of color, and cultural ideas that devalue working with babies and toddlers show up and shape our ECE system. The economic insecurity that early educators face is a direct consequence of underinvestment in ECE relative to the public good that it delivers. Investments in workforce compensation represent common sense policies to bolster any ECE investment. There is no system without the workforce. And they are also evidence-based strategies for retention and recruitment. The 2021 American Rescue Plan, or ARP as we've been calling it, provided a pivotal influx of federal funds for states to stabilize childcare, a system that was already in crisis. Given those funds and the flexibility, many state leaders actually did take the opportunity to invest in the workforce. From 2021 to 2023, our Compensation Initiatives database documented over 95 state and local initiatives to address compensation, many with COVID relief funds. Yeah, we are heartened by these advances, but the system is still far from delivering on compensation for early educators. And that pivotal COVID relief ARPA funding is now running out. And without sustained new federal investment, state leaders are having to step up for the ECE workforce. So what are states doing to champion ECE compensation in this pressing environment? With our work on the Bold on ECE compensation learning community, we work with leaders in 7 states who are building on the momentum from ARP investments to initiate broader and sustained reforms to change how we compensate early educators. What can we learn from those at the forefront of compensation advancements today? Let's dig into some themes and lessons from 7 states in our learning community. Across states, we know that addressing compensation takes significant public investments that are then directed to compensation-specific policies. State organizers, advocates, and legislators can work to identify a sustained state-specific revenue source in the absence of large federal investments. For example, New Mexico established an early childhood trust, and voters passed a state ballot measure guaranteeing funds for early education. And in Vermont, they secured funding for childcare from a state payroll tax established in Act 76. So then, what is the lever for using those investments to meaningfully raise compensation? A common approach to date has been raising childcare subsidy reimbursement rates to programs. To understand exactly how much needs to be invested, states can use cost modeling to estimate the true cost of ECE services that includes standards or benchmarks for wages and benefits. New Mexico used a cost model to inform their subsidy reimbursement rates to programs, and you'll hear more about this later. And Massachusetts conducted a cost of care study to inform subsidy rate setting and to then advocate for those increased investments. However, state leaders face 3 challenges with this approach: rates not being sufficiently high to cover the costs of increased wages and benefits, not all programs receive subsidies, and then without a requirement to use those funds for compensation, program leaders might choose to prioritize other needs. To address these challenges, some states like New Mexico and Vermont are substantially raising rates and eligibility for subsidies at the same time, with the hope that deeper and broader investments in most programs will spur those program leaders to choose to raise compensation. Both states are also taking the next step to establish standards or a lattice for ECE compensation and career pathways. Another theme we're learning about is using contracts and grants to increase compensation. The ARPA grants were a great model for this kind of widely accessible base funding to programs. North Carolina had a novel approach in that they offered compensation grants to explicitly raise wages or offer bonuses or benefits using the ARP funds. And New Mexico used ARP-funded grants to support programs to raise wages by $3 an hour across the board. Continuing now that ARP is ending, Illinois has the Smart Start compensation grant program, and Massachusetts is pursuing, through some bills in their House and Senate, continuing their C3 ARPA grants and keep that program going as a mechanism to increase wages. As we all know, compensation also means benefits, and we've seen a variety of approaches to this piece. During the pandemic, Washington State used ARP funds to cover healthcare premiums, and thanks to collective bargaining, family childcare providers are eligible for state-sponsored health and dental. Massachusetts has followed the example set by Kentucky, who made childcare workers automatically eligible for subsidy by making those who work in a licensed ECE setting prioritized for state subsidy for their own children. And even though it's not funded, North Carolina's salary scale now includes an appendix on benefits, which is an important inclusion in any salary scale. We know that this work comes with challenges and barriers to getting things legislated, funded, and implemented. Across our conversations, many faced political barriers like garnering the political will and confronting elected officials who just fundamentally oppose investments in early care and education, either because of fiscal conservatism or because they believe it's a private family issue and not a public problem. Of course, the political barriers then translate into a lack of public funding available to support the workforce. On the implementation side, in our conversations with educators in particular, we learn about inequities in access to existing compensation initiatives. Those inequities might be based on the setting, the funding stream, the age of the children, or if it's up to the individual to apply, it might be a barrier to do with language or technology access, or simply not knowing about a program. And we know that many states and localities have faced the complicated work of establishing equitable compensation standards that honor the realities and aspirations of the workforce. There are so many approaches to matching levels of compensation to education levels or credentials, or using other methods like years of experience or a competency framework. And we know that parsing through that can be difficult, especially without adequate workforce data or community engagement from diverse educator communities and settings. Now I'm going to pass to Sylvia, who will do a deeper dive in what we've learned from case studies in two of our learning community states, New Mexico and North Carolina.
Thank you, Annie. New Mexico has provided an interesting perspective on what states are doing to advance compensation for the ECE workforce. In the past 5 years, the state has established a number of ongoing wage supplement programs and has used federal pandemic relief funding to provide a $3 per hour raise for educators across the sector. With a huge effort from organizers, they also passed the state ballot measure to direct state revenue to early childhood education and even developed a sector-wide wage and career lattice with hopes that it can be used to raise wages sector-wide. Even though the grants with the $3 per hour raises ended with pandemic funds back in September, New Mexico is still trying to use state funding and increase subsidy rates to advance compensation. To do this, they reformed their subsidy system, as Annie mentioned, by broadening eligibility for families and by creating a cost model that accounts for increased compensation in order to establish high reimbursement rates. They are the first state in the country to do this. We found that several key elements were integral to New Mexico's progress and to laying the groundwork for the future. For example, having champions for early childhood in the state legislature, as well as the centralized state agency, has helped to advance the state's commitment to compensation and to put forward strategies that specifically target it. Both educator and community-led organizing has also proved critical to winning the necessary state funding to make good on New Mexico's vision for compensation. And a continued commitment to equity from advocates and policy leaders has conveyed the importance of racial equity for New Mexican communities and early educators. Despite this progress, early educators in the state still face inadequate compensation and inequities in accessing programs that are intended to support higher wages. Policymakers also face uncertainty about the level of funding available and what it can be used for, especially around whether there will be enough funding to implement long-term reforms like the wage and career lattice. The good news is that advocates, educators, and policymakers are prepared to continue in this fight, and educator advocates are raising their voices about what's needed. One of our interviewees, an early educator in a center-based classroom, told us the competitive pay for professionals $3 per hour raise is a program that helped a lot. It did help us, but I think the right thing to do was not to give it as a temporary bonus, but to establish it as a fixed salary. Another educator said, "So it's time to defend our work, for people to see that things can be achieved by uniting. Unity is strength, and that we can be that voice for many." North Carolina tells us a different but equally important story. North Carolina has been a pioneer on early educator compensation and financial relief since the 1990s. This is most notably seen in the various targeted wage supplements they have established to advance early educator pay. Wages, one of the longest-running ECE wage supplement programs in the country, began in North Carolina in 1994 and has since inspired other similar programs. Advocates in the state have also built a foundation for broader reform on ECE compensation through the work they have done to develop a model salary scale. Although this is currently unfunded, it is used as an advocacy tool for the sector to raise awareness on compensation. And most recently, North Carolina's Division for Child Development and Early Education used federal ARPA funding to offer optional compensation grants to programs to raise base pay and or to provide bonuses to staff, while also encouraging them to use a model salary scale. It is important to note that all of this was accomplished in the context of an increasingly conservative legislature and governance that is divided along political party lines. As of the time of this recording, North Carolina has a Democratic governor and a majority Republican legislature. As may be expected of a divided political government, not a lot of consensus is to be had. We found that the elements that proved key to North Carolina's approach to compensation included a focus on policies and programs that recognize the workforce. North Carolina advocates and policymakers have created multiple initiatives targeting compensation and educational opportunities for the workforce. Given the challenging political context, North Carolina's approach has been to pursue incremental solutions within constraints. Leaders have used creative and layered strategies to address compensation, even though they have been faced with challenges to winning statewide funding for systemic reforms. They have also used data and the input of educators to influence policies. Since the 1980s, North Carolina has conducted multiple workforce studies and has used educator input and surveys to develop and improve existing compensation initiatives. Yet despite this historic leadership on workforce programs, the state's layered and piecemeal solutions have not been far-reaching enough to meaningfully advance compensation for the workforce. For example, the wage supplement programs provide financial relief, but they do not increase pay, and they remain under threat of budget cuts. Nor is the most far-reaching strategy, the compensation grants using ARPA funds, sustainable, as that funding will be coming to an end soon. North Carolina's advocates have made great strides within a challenging political paradigm, but their setbacks reveal the limits of incremental approaches to a systemic issue. Our interviewees spoke about their hope for new potential strategies in the field. For example, an opportunity to shift to a community organizing model and to build political power with early educators to shape the necessary reforms for the state's ECE system. As one of our interviewees, a family childcare provider, told us, "I wish there could be a public campaign about early childcare providers, early childcare professionals, and what we do so that the community where we live, our states, and our families will know what we do and what we sacrifice. Because I feel like as long as they don't respect what we do, we're always going to be a marginalized profession." Now I'll pass to Annie for more on what's next for ECE compensation.
Thanks, Sylvia. We're excited to see what comes next in New Mexico and North Carolina. And we know that there are many other places that are leading the field on compensation. For example, Minnesota has a Great Start compensation grant to providers to increase staff pay, and DC's Early Educator Pay Equity Fund has been an inspiring model to states and localities across the country who are watching and learning from the fund's distribution of payments to the workforce, as well as their program to cover healthcare costs. Of course, like many, we were dismayed by Mayor Bowser's proposed budget cuts to the Pay Equity Fund and healthcare program in DC. We know that now is a time where we need states and localities to step up to fund ECE and compensation, not to turn away, and certainly not to walk back crucial investments. It is imperative for our field to listen to early educators organizing for change both in the past and present day. The worthy wage movement for compensation, starting in the 1970s with Dr. Marcy Whitebook and others, was meaningful because it was led by and for childcare teachers. This historic worthy wage movement asserted early educators as valuable in their own right, not just in their roles in classrooms and homes, but as experts in their field, challenging the status quo and using their voices to advance change. If we don't advocate for policies that are shaped by the perspectives of early educators themselves, we may further entrench inequities for the workforce and families. We need policies that work for providers across settings, including family childcare and those who work with infants and toddlers. We need to address racial inequities in pay and leadership opportunities. And we need to support the organizing and leadership of educators themselves, in advocacy organizations, in unions, and importantly, in coalition with parents, families, and caregivers. Now, here we are in 2024, after years of a global pandemic and a long overdue racial reckoning with the fact that every aspect of our society, including the care of our young children, has been shaped by the history of a nation built on the enslavement of Black people and stolen land from Indigenous peoples. After years of expansion of profit-seeking corporate entities into the childcare sector, after watching Congress fail to pass sweeping federal investments in childcare yet again, and we ask ourselves, why is it that investments in childcare are so challenging to win and sustain, despite polls that show bipartisan voter support for funding it? We are learning from organizers on the ground who know that shifting the cultural and political narrative around early care and education will outlast any incremental policy gains. They know that electing people that believe that ECE is a public responsibility and understand that the workforce is the linchpin of a quality, equitable system is powerful, and that mobilizing and empowering early educators to be leading in those campaigns and those policy decisions is a key part of that shift. Although New Mexico and North Carolina have approached ECE compensation differently, educators that we interviewed as part of our case studies in both states recognize the importance of organizing to improve conditions for the workforce. And not only the importance of educator organizing, but the need for resources, energy, and support for this organizing. New Mexico and DC's story reminds us that once bold investments are won, they can often get threatened. And we know that progress must be defended, that equitable access to funds and implementation must necessarily uplift early educator voices at every step of the way. For our part, CSCCE will continue to document how leaders advance change to better support early educators, even in challenging conditions. We have seen firsthand with our learning community how leaders across states can be creative when they're brought together to share knowledge and support one another. And we remain inspired by those who are committed to ensuring that early educators are valued, compensated, and supported. Thank you for tuning in to our recorded briefing, Bold on ECE Compensation, Lessons from Yesterday's and Today's Leaders. We hope that you will stay connected with our compensation resources and all of our research and policy work. You can do that by following CSCCE on LinkedIn and subscribing to our newsletter on our website. Thank you to my colleagues Sylvia and Marcy, to our funders at the Foundation for Child Development, the Heising-Simons Foundation, and the Stone Foundation. We're grateful to you, our listeners, and we'll end with gratitude to all the early educators, organizers, advocates, and policy leaders who champion compensation in the field.